Hello, everyone, and welcome to this week's session uh, in Collective Learning Certificate 2 Supply Chain for Health. This course is jointly organized by the Association of Pharmaceutical Industrial Pharmacists of Nigeria, the IAPHL Nigeria chapter, and B Skilled. So we are almost uh, nearing the end of CLC2. All of you who started from CLC1, I know it's been a long time. Many weeks have gone by, but I think by this time you are now realizing how all these various things connect with each other to make supply chain a success. And today we are looking into another of these issues, which is very key in health supply chains, and that is quality of products. Because you see, for any supply chains, quality of products is a key objective, that all products, whenever they reach the patient, must be at the right quality, so that the product, uh, for whatever indication that product is prescribed and is being taken by the patient, it um, um, it works like that. Because if the quality of product is not good, then as supply chain professionals, we have not done our job. So it is a very important issue, maintaining the quality of products throughout the supply chain. And today we will discuss what are some of those characteristics of uh, ensuring quality. What are some of the key strategies? Who is responsible? And then we will have some discussions as well on this issue as well. Okay. Today with us, we have Dr. Ukamaka Okafor, which I believe most of you know already. She was with the Pharmacy Council of Nigeria. She was the director of the Lagos chapter for a very long time. Now she is an adjunct professor, and she has volumes and volumes of experience in this area. So today she is with us. She's going to talk about some of these issues. So without wasting too much of time, I will. Okay, maybe there is a poll first, and then I will hand it over to Dr. Okafor. Okay, before Shreya, you launch this poll, let me also bring the focus on this subject, because when we talk about quality of products, one thing, of course, is that as supply chain professionals, we have to make sure that the products that are sourced, purchased, stored at a warehouse, and then transported to the last mile. One, we have to make sure that the quality of those products are maintained, throughout that chain. The second issue, however, is also very important, that we as supply chain professionals, we must understand that we also compete with another industry, which is the industry of fake products, of falsified products. Okay. Products which are intentionally made uh, as fake copies of real drugs, and they are also sold in the market, in black markets or gray markets or whatever it is, and this is a very big issue globally. And Africa, for instance, is one of the hotspots, I would say, of the proliferation of falsified products. So this poll, and in today's session as well, we will also be focusing on how to stop this issue as well. So Shreya, if you could uh, launch the poll. I see some of you have started to put on the chat, but let's put it on the poll as well. The poll is now on your screen. You can select one option, in terms of whether falsification or having substandard products is an issue in Nigeria. There are three options. You can choose one of them, and then we will have a bit of a discussion on this as well. And I think in the first section, I believe this is, yeah, this is for Dr. Okafor. So as soon as we look at the poll results, Dr. Okafor, I will hand it over to you for the first section. Can we look at the results, Shreya? Yeah. So people have selected only two options, either yes, it is very bad, or two, that the stakeholders are managing it well. So I know for a fact that in Nigeria, there are some good laws which have been created in collaboration with World Health Organization, the World Trade Organization, Interpol, to manage and to check the proliferation of falsified products. So falsified products is one which is intentionally made wrong, you know. However, there is another issue of products being substandard. Now, substandard products are not intentionally made, as you can understand. They are made by mistake. But even then, once they're made, manufacturers may distribute them either without knowing, unknowingly, that they don't even know that those products are not up to the standards, or sometimes knowing as well. They would know, but they do not want to, incur a loss, and hence they would distribute those poor quality products in the market. So there are laws in Nigeria today to check all these issues. NAFDAC, which is the FDA in Nigeria, they have a lot of checks in place. However, since Nigeria is a large country, and there are various ways of bringing products in. Uh, Sometimes, they can slip through the official, through the official checks, and can proliferate into the market. And hence, as supply chain professionals, we have to understand these issues very clearly, so that whenever, because it may happen in your lifetime that you see an occurrence or a situation where either it's a falsified products, like totally fake, or you come across a batch of product which is substandard, that it is not fake, it is created, developed, manufactured by a real organization, real manufacturer, but it is not up to the standard, it's of really poor quality, and hence you may have to take some actions. And those, what are those actions, you must know. So Dr. Okafor, over to you, starting with understanding some of these issues and then talking from your experience as well.
Okay, thank you very much, Sanjay, and good evening to everyone that is on this call. The issue of falsified and fake products, I think it's majorly driven by a poorly coordinated supply chain, because if supply chain is coming from both raw materials, manufacturing, distribution, wholesale, importation, and retail, then we can clearly say that the issue of falsified and fake products is as a result of a poorly managed supply chain system, because the distribution system is part of the supply chain system. And if there are laws for distribution and those laws are not being implemented or enforced, then many products will leak into the circulation. And it's a global thing, though more in developing countries. And as you have said, the substandard products may not necessarily be that they wanted to produce. Then some of them too are deliberate, because there are some of them that are as a result of unhygienic conditions of the place where they're manufacturing. Some are because of the poorly trained staff or non-qualified staff that are handling pharmaceutical manufacturing. And in that case, you can also see some that contain impurities. So some standard products may be substandard, not because they don't have the potent or the active ingredients, but because maybe they have some impurities or they have some contaminations like bacteria or some other things, or even some chemicals that may be due to poor packaging have leaked into the products. So there are so many cases of falsified products that are due to poorly coordinated supply chain systems. And we have the recent one in Gambia that took a lot of children's life, which I know pharmacists also rose to the occasion through the West African protocol of pharmacists, but already the children are already dead, 66 children. Then you have some in Indonesia, you have in other countries, and we have also had some part of that in Nigeria and some other countries. So fake and substandard products and falsified products, substandard and falsified products is a global menace that is driven by so many factors, but the major factor that is driving it is a poorly coordinated supply chain system. Next. So the quality of products actually is a big concern in all over the world, as I said before, because 200 billion US worth of fake medicines are sold every year globally across both developing and low and medium income countries. And some of these products have been reported by WHO in Africa, and some are also reported in other places. But Sub-Saharan Africa and the Greater Mekong, the Greater Mekong sub-region like Vietnam, Cambodia, Laos, Thailand, we have more of the falsified and substandard products more than in many other countries. And the high prevalence, the prevalence is so high. I saw the poll that we all did, and many people said yes, it's a very serious problem. Then very few said stakeholders are doing something well about it. Maybe during the discussion, those people, the 11% of those that said the stakeholders are managing it well, maybe they'll be able to tell us from their own perspective what the stakeholders are doing to manage it well, as they said. And those also that think it's a very big issue and it's not being managed well will also tell us from their own perspectives. And one of the major factors also, apart from the supply chain that is either not coordinated well or is broken, one of the major factors also is out-of-pocket. Out-of-pocket payments contribute largely to falsification of products. And you may ask me why. We all know that in many developing countries, including Nigeria, the public buy drugs, purchase their drugs out of their pockets. Even when there is national health insurance that we have now, you can know that not more than 10% are in that health insurance. And the health insurance has not been made mandatory. Like in Lagos State, there's a health insurance coming up, which is mandatory, but it has not been enforced that every person in Lagos State or in other state will be enrolled in the health insurance. And when people are not enrolled mandatorily in health insurance and they're buying their products out of their pockets, they tend to want to buy the cheaper one, because if they continue to buy all the products out of their pockets, it's going to impoverish them. The drugs that they're taking, money that they're using to buy drugs is the same money they're supposed to use to pay their bills, to pay their house rent, to build their houses, to eat a balanced diet, and to do other things, to pay school fees for their children, and to actually run their entire life. But if almost every money they had in their pocket is spent on medicines, they're going to react by trying to look for where is the medicine cheaper. And because people are looking for medicines that are cheaper so that they can save their money and do other things, so it's driving falsification of products. Because those that are falsifying products, they are being like, not that, not, I'm not holding brief for them, but if we are not patronizing them, looking for cheaper products, they may, it may discourage them from selling the product. But if they know that if there is a product in the market and they have gone to import, do parallel importation of another one that is falsified, and people are buying from them because it's cheaper, and because people are poor and they need to buy drugs from, they need to buy their products, not only drugs. People want to buy things cheaper so that they can have money for other things. So the out-of-pocket payment actually is contributing largely to falsification of products. So people want to falsify the product. People want to make a substandard one. People want to employ workers that are not qualified to be employed because they want to make their products to be cheaper. So what are the characteristics of quality assured products? So for you to say that a product is quality assured, you have to first of all, look at the identity of that product. So does the product have the correct ingredients? Does it have the correct active ingredient, the correct excipients? Does it have the correct strength that it's supposed to have? So what is the identity of that product? What is the dosage, the strength that is intended? If the paracetamol is intended to have 500 milligrams, and we talk about identity, that means you have to be sure that what is written on the packet is actually what the product contains. Then the product also has to be pure. It will be free from contaminants, from different things, including microorganisms, including chemicals, products from degradation, residual solvents. So you have to be sure that the product contains only what it is supposed to contain, and also that the product is appropriate strength, that if it's labeled to contain 500 milligrams, that is what that product contains, and that the strength is the standard that is supposed to contain for it to ensure that it's effective when taken. Then the product also has to be stable. If a product is quality assured, it means that it's also stable at the environment that is stated for the storage conditions. So if a product is stated that it to be stable at -4 degrees centigrade, then stability will ensure that that product is stable and that the potency is intact at that particular storage condition. Then that the product also is potent, that it has to give the response that is intended to give. And then that product also, that in all the parts of the product, that there is consistency in ingredients, that is uniform, that every part of the product is containing what is supposed to contain in all the parts, that you don't have maybe the API at the center of the tablet and then at the other side there's nothing there. So the product has to be manufactured in such a way that it is uniform completely. Then it also has to be available in the body when taken. It has to be in a situation where when it's taken, it will be completely absorbed the way it's supposed to be absorbed in the body, and not that the product is supposed to be absorbed in the stomach and the absorption already is starting in the mouth, or that is not even absorbed at all. So that product has to be available to the body for it to work. And then for injectables, for sterile products like eye drops and other ones, the product has to be pathogen free. So there shouldn't be any bacteria or any type of microorganisms that will be a contaminant in that product. So all these 8 factors are the indicators for a quality assured product. Next. So we want to talk about the quality assurance framework. So a quality assurance framework is a structured approach that can be implemented in a supply chain so that the products meet predetermined quality standards. So every company is supposed to have their own framework, and whether it is manufacturing, distribution, or any type of company at all, there should be quality assurance framework in every organization that is manufacturing medicines. And it's always a policy thing It's always a policy in the procedures and the practices that are designed to establish and maintain quality throughout an organization. So you come to the organization, you find out that they have what they call quality manual. And that quality manual is where where they document the plan for their quality. It's in that manual that they document how they will implement the quality framework, how they will review it, and how they will improve on the quality. Because when you talk about the planning, then in planning that quality, you have to be sure that the policies are in place and that the guidelines that all the processes to ensure that quality is achieved in that organization and also maintained. And the quality plan also has some quality objectives, and these goals are measurable with indicators, and it is the organization that is supposed to ensure that the quality is achieved and maintained. And that quality, of course, is driven from standard. It's not as if the organization is going to make their own quality and quality assurance framework. They will adapt from what is already in place that is approved by the regulatory agencies. So they need to adapt it and domesticate it to suit their own organization. And then there are some procedures that have to be implemented also in that organization that has to be in place to ensure that the products and services are of quality standards. And they also have to have some operational plans that are in place to prevent any form of quality issues. So they have to follow their SOPs. They have to follow all their guidelines to ensure that there is no leakage, that there's no broken wall in their guidelines. So if the company has followed their SOP and they ensure that the SOP is followed, but in many situations, you see people, they just hang the standard operating procedure on the wall and nobody is making sure that they follow it. Even in retail premises, not only in manufacturing and importation, it got across the whole supply chain system. People make SOPs and nobody is asked, is like mandated to ensure that these SOPs are being followed. So most of the time, it's always when there's a problem that they will now go back and they realize that the SOP is not being followed. Because if the SOP was followed, there wouldn't have been that loophole to that particular level. And also talking about quality audits, the quality audit is not only by regulatory agencies. There's also internal audits. Companies also audit themselves by themselves on regular basis, to ensure that the standard in the organization is being met. So the quality audit is not only when the NAFDAC or Pharmacy Council or other regulators come to the place to do the quality audit. Internally, there should be an audit, first of all. The company in their quality plan, quality manual has a periodic time that they do their own quality audit, apart from the one that the regulators now come to do. And also, as they do that quality audit, they have to do improvements. There's a continuous improvement in the quality assurance. Quality assurance framework, as we know, is not a quality control. It's not that you want to come and test in quality in a product. It is a case of you have a framework that assures quality from beginning of the process to the end, so that when the final product comes out, it is a quality product. Not that you wait until there's a problem, you now try to control it. No, the quality assurance framework ensures that quality is built into the system from the beginning. So as the company does audit, then there will be continuous improvement. So that continuous improvement is part of what the quality assurance framework is all about, because it involves an ongoing effort to improve the quality of the product and services. And it's also based on either what they've found out in the audit, or from what they have found out from the feedback, or from what the customers have told them, or from the complaints the customers has given to them, or even from how they analyze their data. When they are doing their appraisal, they also analyze their data. They do both internal and external analysis of what they've been going through from that particular period under review. then that will now help them to improve on their processes and to ensure that quality is assured in their system. Next.
Dr. Okafor, if I may just add one point here. Um, so this is for everyone. See, this quality assurance framework, uh, we have kept it a bit generic here, so that you can understand that this applies to everyone. Now, you can be a pharmaceutical manufacturer, it applies to you. You can be a wholesaler, distributor, a pharmacy chain, importer, it applies to you. You can be a national or a state supply chain agency like a DMA or an LMCU, it applies to you. Or you could be a hospital or a health facility clinic, it applies to you the same. The only difference is that at each level, your activities change and your objectives change. So when you plan, you understand what are your quality objectives depending on what type of institution are you and where are you located. Then those objectives have to be met using some of the interventions, which is part of your implement box. Then those have to be reviewed so that you know whether the quality of products are good based on whatever interventions that you have planned. And you need to institute a continuous improvement cycle, just like Dr. Okafor have mentioned. So this framework applies to everyone, no matter where you are located. This is, again, it's very similar to a management framework, but in this case, this is very specific to make sure that the quality of products are maintained. Yeah. So just wanted to make sure you understand that, this is applicable to each and every one of you. Okay. Dr. Okafor, back to you.
Thank you very much, Sanjay. And someone was telling me just 2 days ago, somebody that has a retail pharmacy was telling me that there was a fraud in his pharmacy, and he had lost like 11 million within 3 months. And I was asking him that what happened? Was there nobody that is checking? So they found out that there was somebody that was assigned to be checking the POS, the so many things in the pharmacy. And the person will just get up in the morning, go and collect money, pay in the bank without checking anything. So you see that they have SOP. There were guidelines in place, but the guidelines were not being implemented. And that was why they had a fraud of 11 million within 3 months. Assuming the quality assurance framework was being implemented to the letters, the person that's supposed to be checking that would have found out even within 1 week that fraud started. But the fraud started like 3 months ago, and they never found out until they became catch trapped. They couldn't pay for their products again. When they purchased products, they couldn't pay. And that was when the owners started wondering what was happening to their business, and they found out that the sales staff had been stealing their money, and they didn't know. Thank you very much. Next slide. So understanding the implications of poor quality products in the supply chain. So one of the implications of poor quality products is health risk. Like assuming an antibiotic is substandard or falsified, maybe it does not have the enough ingredients it's supposed to have, and someone keeps taking the antibiotics and the thing is not working. Either it is not working and the patient continues to get worse and worse, or that the patient maybe gets healed after some time, he comes back and the person develops antimicrobial resistance. So there are so many health risks that can, or maybe something like vaccines. You can imagine when the vaccine is not potent and is being given to children to prevent something like tuberculosis, and the vaccine is not potent. And so you can imagine the risk, the level of risk that the community will have in their health. Also, wastage of resources. When there are poor quality products, of course it's a waste of resources because the manpower has been used. So many resources have been invested in manufacturing those poor quality products, and with all the resources invested in them, they are not able to do what they're supposed to do. and also loss of trust from patients. When patients continue to take poor quality products, they will not get the response they're supposed to get, and they will have and they're going to have they're going to lose trust in the healthcare system. I remember one of my church members I was trying to help recently. I wanted to help him to get some of his prescription, and he refused. He said I should give him the money. I said, why should I give you the money? He said, because I've been buying the drugs, they're not working. So you don't want to go to have herbs. I told him I'm not the one that's going to, you can't use my money to go and buy what I'm not sure that it contains. And he refused. He said he showed me so many packets of drugs that he had bought, that he had. So it comes to a time when patients perceive that the orthodox medicine is not working, and therefore they lose trust from the healthcare system. And that trust many times comes from poor quality products. It's not it's not always that the doctor does not know what he's prescribing, or the pharmacist does not know what to give to the patient. But it has to do with the fact that the products they've been taking before, they are low quality, and they have lost trust, and they begin to look for other avenues to get themselves their health restored. Either they start taking some herbal concoction that they are not sure of what is inside, or some of them go to religious places and some other places where they think that they can find help. And so that is one of the problems of poor quality products in supply chain. And also it has legal implications, because it's a policy thing, and no one is supposed to produce poor quality products. And when there are fake or some standard or falsified products, it has legal implications also. And it's also it increases healthcare costs, because people keep taking drugs that are not working, and they keep spending their money when they're supposed to, and they take one and they say it's not working, they use a higher one. So you see somebody that's supposed to take amoxicillin, clavulanic acid, the person has taken it, it's not working, maybe because it's fake. The person goes to ciprofloxacin, it's not working, it goes to levofloxacin, like that. So it is that same patient that is buying those drugs from one drug to the other and not getting the correct response is supposed to get, because the products are of low quality. And then resistant to treatment, which is actually what is driving the increased health cost and the wastages, because people are not getting the correct treatment they're supposed to get. Like, as I said before, in antimicrobial agents, if the quality is poor, it's substandard, and is not able to treat the infection that the person is having, and not only that, it's not able to treat the infection, it also exposes the person to resistance, to the extent that that person, even when you give her or him that particular drug that is okay, is not going to manage that condition. So these are the implications of poor quality products. It's not all exhaustive, but at least these are some of them, that when there are poor quality product in the circulation, these are some of the implications. So there is need actually for both all the stakeholders, not just only the regulators. There's need for all the stakeholders, including patients, to address the issues of poor quality product across the supply chain. Thank you very much. And at this junction, I will hand over to Mr. Sanjay
Yeah.
to coordinate the discussion forum before the
Yeah.
next
Thank
lecture.
you. Yeah, thank you so much, Dr. Okafor. And indeed, these are some of the major implications, I would say. But before I go to the discussion about ensuring quality, if any of you have any question on how some of these implications are because of quality of products, you can ask. Or actually, I wanted to ask one question to everyone as well, because a lot of times, as pharmacists, as supply chain professionals, we may not understand how poor quality products lead to resistance in treatment. For example, antimicrobial resistance, which is a very important issue today globally. So if anyone would like to, unmute themselves and talk how poor quality products leads to antimicrobial resistance, that would probably help everyone. I mean, of course I can explain that as well, but I would like someone from the group take lead on this and explain from their own understanding and perspective how poor quality products also result in creating resistance, antimicrobial resistance, because this is one of the bigger, very big issue happening globally and also in Nigeria. I see some people are unmuting themselves, so please you can speak. Ibrahim.
Yeah, good afternoon, all.
Yeah, good afternoon.
Yeah, poor quality products can lead to antimicrobial resistance, because when you look at the mode of action of antibiotics or antibacterial, there has to be a certain concentration that needs to be reached before it can exert its effects on these microbes. This concentration level is called MIC. That's minimum inhibitory concentration. So it has to reach that certain level before it can exert its antimicrobial effects on these microbes. So getting poor quality product, meaning that the MIC will not be reached, and this poor quality product will only attack the microbes at the surface, maybe peripherally, and at the end of the day, the microbes becomes more stronger. They will adapt to that environment and become more stronger, and before they can also change their modify some of their genetic composition with time to become resistant to that particular antimicrobial resistance. So in a nutshell, the MIC, minimum inhibitory concentration, would not be reached using poor quality products. Thank you.
Yeah, that's correct, Ibrahim. I'm sure all of you have heard this phrase which says, "What does not kill you makes you stronger." So,
Yeah.
this is what it is with poor quality products, because what happens is, just like you mentioned, Ibrahim, uh, sometimes when the products are of poor quality, they may not have the right amount of APIs, active ingredient, and hence not the right amount of strength. And hence they may not kill that microbe entirely. So the microbe will adjust itself after some time, and then it will become resistant to that product. So then when the patient retakes that product, even if it is of the best quality, but by that time the microbe has gained resistance to that product, because the previous time that product was of poor quality and it had not killed the microbe. Of course, it does not happen in just one occurrence. It happens when this scenario is repeated multiple times in many patients, because generally, see, all these microbes, they travel from one person to the other, from person to nature to water to air to some other things, and then from there again to different people as well. So during all this process, they keep on adjusting to the molecule that they were subjected to, and hence poor quality of product has been termed by World Health Organization as one of the key enablers of antimicrobial resistance. And one of the key interventions to stop resistance is to stop spreading poor quality products or fake products or substandard or falsified products. So it is very important. So think of it like this: as supply chain professionals, if we are not able to stop the spread of substandard products and falsified products, eventually you will see that all these antimicrobials that you prescribe, if you are pharmacists, or even if that your family takes sometimes when they are sick, all antibacterials, all antivirals or antifungals, eventually you will see they are not as effective as they were once, and that's a big concern. So this is something that hits you very closer to home, if I say it like this. So again, the reason why I'm saying all this is to underscore the importance of understanding the implications of quality and doing each of our duty as a supply chain professional as well, because if we don't uh, maintain the quality of product, then that is a big issue that creates a lot of issues eventually in our healthcare system. Okay, moving on. So we have a quick discussion. So we will do it in plenary only because I've seen it gets difficult when we divide you into groups. So this one is a quick one. So we will discuss why sub-Saharan Africa is a hotspot for poor quality products. And of course, in this particular case, we will discuss the case in Nigeria. Now, there are 5 issues which are listed on screen. Now, in Nigeria, some of it may not be an issue. Some of it may be good. So, for example, there may be some policy which is very good. There may be enforcement happening. But some of it out of these 5 or maybe something else can be an issue. So I want you to read that, okay, out of these 5, policy, enforcement, sourcing, that means sourcing bad products. Sometimes, as we were studying procurement in CLC1, we realized that if we don't procure the right products, from the right manufacturers, that may also result in having substandard poor quality products into our supply chain. Okay, then logistics issue. So if our storage and transportation is not good, that may result in products being subjected to poor conditions and hence losing their potency and losing their quality characteristics, which Dr. Okafor explained in the initial slides. And then finally, financial issue. Again, Dr. Okafor said this. When people, they can't find products to be affordable, then they will go to some alternatives which are probably cheaper and most times are not the right quality products. So I want to think about which out of these 5 are an issue in Nigeria. And then we'll write on the slide itself. So Shreya, maybe you can take it out of slideshow mode, and then in whichever box that we discuss, you can write those key points. Okay, maybe zoom it up a bit. Yeah. So on the left panel, yeah, you can shorten it. Yeah, exactly. Yes. So the floor is open. So anyone who would like to talk about any of these issues in your state, in general, or in Nigeria, let's begin. And then we will go through each of these points and see what are some of the issues that are there in Nigeria. Again, like I said, some of it may not be an issue. Yeah. And then we will also explain some of these from our perspectives. So who's going first? Okay. Anyone?
Good evening, everyone.
Good evening, Blessing.
Yes, I would like to talk on the financial issue.
Mm-hmm.
Yeah, of late, because of the economic situation in the country, there has been a hike in the price of medications. So, for instance, drugs that are costing, let's say, 3,500 naira, because of the hike in the price of drugs from, let's say, 3,500 naira to let's say 13,000 naira. Most people would prefer to eat and to cater for themselves than use that large amount to buy medications. And then we now have people that sell herbs and claim that these herbs can actually cure many illnesses. We have all these concoctions which you can't even ascertain what they contain. And you see people subscribing to it because it's much cheaper, not knowing that in the long run it would have an adverse effect on their health. So these are some of the issues around the quality of medications.
Okay. Yeah, Shreya, I've sent you some points which you can write. Yeah. So, Blessing, that's a good point. Now you said that lot of medicines, their prices have increased because of high inflation, or even because of the low value of Nigerian currency. If you if we go 1 year back, or 1.5 year, I think, Nigerian currency with respect to dollar was much higher than it is today. Now, as you all know, a lot of products in Nigeria are imported. So if the products are imported, that means whoever is buying the products, they are buying them in dollars. So now they have to pay more. So if they are paying more, eventually they will pass on that cost to the patients. So that's how the costs of products are increasing, and some way or form it has to be checked. Maybe by using more products from the local manufacturers, or giving some sort of subsidies to patients for specific indications. But of course, all across the board, generally prices would have increased in Nigeria over the last year and a half. So that's a good point. Now let's go to someone else who would want to speak about any other issue listed on screen. Edikanan, did you want to speak? You unmuted yourself. Okay, no, not really. Okay.
Okay, I would also. Okay.
Okay, let me hand it over to Edikanan first. Edinaken, sorry, and then some.
Hello, good evening, everyone.
Good evening.
Good evening, everyone.
Yeah, we can hear you,
I
Edikanan.
hope you are hearing me.
Yes, we can hear you.
Okay. Aside from the points listed above, I just want to mention something under what else,
Okay.
which is distribution,
Mm-hmm.
medicine distribution in Nigeria.
Okay.
The medicine distribution in Nigeria is uncoordinated and chaotic. This gives room for miscreants, repackaging drugs. We have an open drug distribution in Nigeria. You can just buy drug anywhere at any time. So, as open as it is and uncoordinated, these miscreants, they can repackage expired drugs and selling it as quality drugs to people and redistribute it, counterfeit drugs to people. This is not well regulated because it's so open. The distribution system is so open, right from wholesalers to the public. So I think this chaotic distribution needs to be addressed to ensure good quality products for our people. Thank you.
Okay. No, that's a good point, Adinakin, but I think it can go under logistics, because it's partly logistics, and I mean, you can add some part of regulation into it as well, but I think distribution can be put into logistics. Let's hear from Ibrahim, and then I will summarize at the end. Ibrahim?
Okay, thank you, Sanjay. I'll contribute on the two issues,
Okay.
policy issues and enforcement issues. When you look at in Nigeria, we have policies, but most of these policies are not implemented, meaning we have weak implementation of such policies. For instance, when you look at prescription policy, antibiotics are supposed to be prescription-only medicines, but you can find antibiotics anywhere. You can find people selling antibiotics subdose, people cutting for instance, somebody can just go and buy one capsule of ampiclos, one capsule of amoxil. So we have a kind of weak policy implementation or weak enforcement of such policies. We could have beautiful policies on antibiotic nutrition, antibiotic resistance, but the implementation is lacking. And as rightly said by the last contributor, issue of weak distribution system, which should be fall under logistics issue. Thank you.
Yeah, thank you so much, Ibrahim. Isaac?
Yeah, thank you very much. One of the issues that is responsible for this chaotic is the regulatory. I think when Mrs. Okafor was talking, they are supposed to, well, the Federal Ministry of Health is coordinating everything. The Directorate of Food and Drug is there. Pharmacist Council is there. So I'm not aware whether I know that Pharmacist Council only go to markets to check whether the premises are registered or not registered. But I'm not aware whether they have a department that take the drugs to sample and be sure that it is what is purported to be that it is. So weak regulatory system is a very, very critical factor that affect the quality of drugs that is in circulation and available to the population. So there is need to do more in terms of regulation and control. It's an all-commerce game in Nigeria that once you have money and you can open a premises and you are good to go. People also travel and imports, all those things are not checked. So it's the poor status of our economy, just like you
Okay. Isaac,
said.
we could not hear the last point here, but I think we have understood your point, which is about weak regulatory. Let me give the floor to Dr. Samuel for his point. Dr. Samuel, over to you.
Thank you, Sanjay. I just have a little uh, contribution and maybe a little disagreement with you on the contributions of Adineka, the positioning of our contribution that is talking about the unregulated distribution system, putting it under logistic EU. I think in Nigeria would not be too appropriate. What she was trying to also talk about is talking about the open drug market system that we run today in Nigeria. Not just about loose distribution. We have open drug market. We have the Dumota market. We have area market. We have Bridgehead market. Before now, we have Zabongeri market in Kano. The area is in Aba. The overhead, the White Bridge markets, drug markets in Onitsha, and Idumota is in Lagos. So, and there are other small ones in many other states where the drug handlers there are acting like cartels, and no NAFDAC does, even when NAFDAC goes to such markets, it's just for shy play. And that's why pharmacists talks about one of the issues that pharmacists have with NAFDAC and even the council, that instead of coming to pharmacy, poor pharmacy, to ask them, oh, where do you have, you're selling a registered product. You know where these products are, where these products are purchased. The bulk of these products are, they are in the open drug market. And therefore, the open drug market was not pulled down. By policy statement, the open drug market was supposed to be pulled down. It has been shifted from 2010. The last one was 2018, when the then minister, what's his name now? The former vice chancellor of the former CMD of UCH, when he gave a policy document that, oh, because of the National Drug Distribution Guideline, the open drug market will be closed by 31st of December 2018. And here we are in 2014. Those markets are still thriving. They are even getting stronger than before. The only success that was being made was in Kano, where the Zabongeri market was pulled down forcefully. So it is not logistic, it is policy. So in Nigeria, we have policy document of rational drug distribution guideline, but which is not being implemented. So we have failed implementations of the policy. The policy is there, which was crafted in 2005 and modified since that time to now, are yet to be fully implemented. It was only about how many years ago, 4 or 5 years ago, that again the council brought in, okay, let us have coordinated wholesale centers, like the one in Kano currently. When they felt that, oh yeah, it will be difficult to pull down the open drug market, they decided to create the policy came up that, oh yeah, we create a coordinated wholesale center where, yes, it will be a conglomerate, a drug mart for all your cares. But in that drug mart, there will be NAFDAC, there will be Interpol, there will be police, there will be MBLA, there will be all of them, you know. So the only one they have succeeded in curating is the one in Kano. So in other words, I'm just trying to stress the fact that if we're not going to put open drug market as a categorization on its own, then it will not be on logistics. It will rather go to probably the policy issue in Nigeria. Thank you.
Yeah, Dr. Samuel, this is noted and we have put it under policy as well. But I think at this point, I should also invite Dr. Okafor because Dr. Okafor, you may have seen all this, what is being talked about by our dear professionals and learners here. So any points would you like to put across on how in Nigeria these open markets and loose dispensing and distribution policies can be checked? And how, for example, like Dr. Samuel mentioned that in Kano, they were able to uproot it, but there are a lot of other places where this is still a very prevalent issue. So any points from your side?
Okay, thank you very much. I didn't expect less.
Sorry, the way I am, there's a bit of a... Can you hear me?
We are hearing you.
Okay, yes. So the procurement sometimes in ministries, particularly Ministry of Health, when they are doing procurement, or even at the hospitals, they are big hospitals,
and they do procurement, issues of quality can be a challenge. Usually, at the Ministry of the Hospitals Management Board, had oversight over general hospitals. Used to try to, looking at the issue of quality, used to try to pre-qualify suppliers, try to see that those that can do business of medicines and supply hospitals or even the state are the quality of their drugs, the sources where they are getting it from is important. And during the procurement process, and the hospitals are made to follow those lists, the list, and then if, even in the procurement, it's not necessarily the list quality. It's not, the cost is important, but it's not cost at the on the altar, sacrificing quality on the altar of cost, trying to ensure that the drugs are of minimum standards. But I've also discovered that for part of implications for quality is that when the sources where we are buying medicines are not properly standardized, there's a limit to how much those that are procuring at this level can get. So they need to ensure that we have quality sources. So right now in Nigeria, there is a tendency to go towards developing drug management agencies where sources of medicines come from, you know, you know, sources that are standard, and maybe major importers and wholesalers can now make supply to the drug management agency that will now, so the health facilities will now procure from the drug management agency. That way, issues of quality will be at the front burner and will be handled. Thank you very much.
Thank you so much, Madam Batur. Dr. Okafor, back to you. Sorry, I guess there was a miscommunication, but Dr. Okafor, back to you.
No, it's okay. Thank you very much. And I didn't expect less from what they've said, because what they've all said are correct, including the one that was said by Dr. Adekola. The open drug market is already a policy issue, which you have already said here. But I think that the Pharmacy Council of Nigeria, working with NAFDAC, are very committed now in dislodging the open drug market. And that was why they started with the one at Kano. But what they are doing is that they will not dislodge them, and they won't have a place to go. So I think that is what is holding them from dislodging the other open drug markets. Because in Kano, the coordinated wholesale center has been built and completed, and the medicine sellers refused to go there. So it was like the government has seen that everything is set for them. They just that they don't want to go. So what the Pharmacy Council of Nigeria is doing now is to ensure that there are coordinated wholesale centers in all those places where they have open drug markets, so that when they want to dislodge them, they won't dislodge them into the thin air, because if you dislodge them, where are you dislodging them to? So it's not as if that is the most correct thing to do, but we are in an environment where a lot of politics are also playing out. So the government agencies are also trying to be wise and diplomatic in enforcing the policies. So that is what is holding the other ones from being dislodged. So I'm sure that as soon as the Lagos one is built, what happened in Kano will also happen in Lagos and in Aba, other places. Thank you very much.
I think that's a fair point. Dr. Samuel, I'll come to you very quickly, but I have one point here which I want to put across. I think the issue here is also linked to livelihood of people, because I think this practice of open drug market is very old in Nigeria. Like for example, in Thailand, it's been going on for more than 100 years. And at that point, there were no regulations. There were no regulatory agencies who would check the quality of products, or would only accept registered products. People would go and buy products as wholesale from some companies, and they would come and sell them. So as much as it is an issue of quality on one side, on other side, it is also an issue of livelihood for a lot of people. So I think just going and uprooting that market may pose another type of issue. So I think another way of looking at it is that uh, the regulators can go and check which out of, because see, in an open market you would find so many vendors, and you can actually go and check which of these vendors can you bring to mainstream markets and make them pharmacies or link them with pharmacies, so that they come under the purview of regulation, rather than just telling them don't do it or uprooting that market. Because what will happen is you uproot one market, they will go and set up their shop somewhere else. But if you regulate them somehow, by, I don't know, educating them or asking them to register those products or asking them to only sell registered products and making them understand what that means, maybe the open drug market can also become a regulated market. But that is my point of view. I have been to one open market in Thailand. I have not seen the ones in Nigeria. But in Thailand, they are doing this. Now, instead of uprooting some of them, they are giving them licenses. So they are asking people to apply for those licenses. But anyways, I will quickly go to Dr. Samuel again.
Yes, thank you, Sanjay, and thank you, Dr. Okafor. I think, I mean, she put it the way it is. NAFDAC and PCN are collaborating to see how they can save the country of the danger of the food drug market. But I think because this is a national policy, unfortunately, the success that is being recorded in Kano was because of the buy-in of the then governor of Kano, like the Ganduje, who was the one who did all his commitment to build that market. Unfortunately, in many of these other areas where the markets are based, for example, the one in Lagos, there is no political will, even from the government and the host communities of this market, who believe that the kind of tax, the host community believe the kind of tax, the kind of charges they make, money they make from that market on daily, monthly, weekly basis will not allow them to be located. So it is unfortunate that a national policy is being left in the at the mercy of the state government, and that's the point which we must be clear about and made I mean.
Yeah, Dr. Samuel, I think we've lost you, but I think we've heard your point. See, like Dr. Okafor mentioned, sometimes.
To build.
Okay, he's back.
This facility, like the one in Kano, in all these regions, and bring these people there. Yes, now that we know livelihood is concerned, it's an issue. So to say that right now, Nigeria,
okay,
environment that does not support registration, even the practice itself. So it will be difficult to have such environment. I mean, people registered in such, licensed in such environment.
Okay, Dr. Samuel, you are cutting off in between. We have to, Dr. Samuel, you are cutting off in between. I think we have understood your point.
Thank you. Thank you.
Thank you so much. We've understood your point. In summary, let me summarize this very quickly because I'm also a bit concerned about the time and we have to cover a few more things. In summary, as you see here, uh, poor quality can be because of a lot of issues. it could be a policy issue, it could be lack of implementation of the policy, it could be an issue of not buying properly, it could be a logistics issue, it could be a financial issue, and there could be some others. Like, for example, it could be a political issue, like Dr. Samuel is talking about. Now, with this in mind, we will move to a next section. Shreya, we can go to slideshow and the next slide, which talks about who should be accountable, who is accountable. Now, this is a good segue to what Dr. Samuel was mentioning, that some people are not willing to, implement a national policy in the states where these open markets are. Now, what happens eventually is that instances like the one that happened in Gambia, those kind of things happen. And when those kind of things happen, then begins the, in all of our countries, we start pointing fingers. So then we have to figure out who is responsible for those kind of instances, whether it is the uh, federal minister of health, whether it is the state minister of health, whether it is the chief of the DMA, whether it is the chief of the NAFDAC, whether it is the importer who imported, whether it is the open drug market from where some of those drugs were bought, whether it is the custom official or the pharmacist or whoever. So what happens is that because of these issues, when instances like the one in Gambia happened where a lot of children died, we start pointing fingers. However, quality of product is such an issue where instead of pointing fingers, we have to work more collaboratively. We have to be proactive. So instead of reacting to any event, we have to ask that how should we prevent something like this? And that's where we as supply chain professionals, uh, as much as I know that sometimes there are a lot of political issues that may prevent us to do the right thing, or uh, you know because of political issues some good policies are not implemented. But since as supply chain professionals, those can be beyond our control, what we can do is we can be proactive in the area that we are in. So, for example, if you see here, on the screen, there are some supply chain functions which are listed, which you studied in CLC1. So, for example, selection of products. For example, Madam Batul talked about the list of products which are supposed to be bought. Then their procurement, then their warehousing or storing, and their transportation as well. Now, on each of these supply chain functions, we have to embed certain practices which results in maintaining the quality of products. So to start with, when we are developing the list of product, we need to first of all write the correct specifications of those products and you know, uh, write them in a generic format, for example. Because if we write them in a branded format, then we are restricting ourselves to buy only that brand, which means that the price of product may be very high. And eventually what that would mean is that a lot of patients would, instead of buying it from the pharmacy, will go to the open drug market. And you can ask yourself that why patients are going to the open drug market. If you stop that demand, then the open drug market will automatically die off. But the reason patients are going to the open drug market is because we are not selecting and procuring the products in the right way. And hence, our prices are very high. Same with the procurement. So when we are procuring, one, we have to make sure that we put in clauses about quality, and we make sure that we procure in a way that we get the best prices. Okay, so that at least to some extent for the patients, even if the prices are not very high, they are borderline affordable. And we tell them very clearly that these are the products which are of good quality. But first of all, we have to be sure that we have purchased good quality products. So if, as a regulated pharmacy, as a regulated supply chain agency, If you are giving affordable products to your patients, they will not go to the open drug markets. You cut off that demand from the get-go. But if your products, their prices are high, they are not of good quality, then of course the patients will eventually go down to open drug markets. you know so as supply chain professionals, at least this is something that it is in our control, and we should be thinking about doing it. Same with warehousing and storing. How should we make sure that we store the products in a way where we maintain their quality? For example, having the right temperature, right humidity, right environment, making sure they are not damaged, so on and so forth. And same with transportation, making sure that they are properly handled, labeled, packaged, and also transported in the right condition, right good distribution and storage practices, for example, compliant to those standards. So if as supply chain professionals, we do our job right, then part of it will mean that the patients are finding the products in the regulated pharmacies at probably an affordable price. So if they find it there, they will not go to the open drug markets, or they will go there less. you know so you as supply chain professionals have the ability to cut down the demand of those open drug markets, and if you are able to do that, then you will see eventually those markets will die down. But if your prices are high, if your quality are low, I mean, then you are giving more fuel to those open drug markets. you know um so what can you do? What could be some of the strategies that collectively, different organizations together, that you can implement to maintain the quality of products? So for example, first is your quality standards. There are so many quality standards which are there, right from the specifications of products to safety to storage and distribution. There are so many of these standards which are already there in globally, which are also adopted by Nigeria. And they could be used and referenced at a federal level, at a state level, and even below. Okay. Conducting regular audits. So, as hospitals, as supply chain professionals at DMA or LMCUs, you should be auditing some of your suppliers or manufacturers or wholesalers or distributors. Okay, because you have to make sure that whatever standards that you have established or have been given by NAFDAC, they are complied with. So even if you don't audit them like NAFDAC, at least talk to them, get some documentation in, and make sure that whatever they are selling you, they comply with the right standard. Or if you are unable to audit, at least work with NAFDAC or any of your state bodies to make sure that it is the case, so that you are able to understand that the products that you are buying and you are distributing or dispensing to the patient, they comply with the right standards. Then implementing a systematic quality management or a quality framework, which you studied initially, which Dr. Okafor explained. So you must have this quality assurance or quality management framework where you plan, you implement, you review, you check and you review for continuous improvement, and it is very important. So no matter where you are, what kind of organization you are, you must have this. Then as DMAs or NAFDAC, uh, conduct product testing when needed. Now, if your product from the very beginning is of poor quality, if you test it, it will not become good quality product. Okay. But that does not mean that you should not test some products. Some products can always be tested, sampled and tested, taking from the market, to make sure that those products which are in the market are of the right standards and quality. But even before testing, your selection, your procurement, your transportation logistics should be good, so that even if you're going for random testing, it gives you good results that, okay, your products are good. Because if you find your products are of poor quality when the products are in the market, then you cannot do anything about it. Then those products only will have to be recalled and they will have to be destroyed. And then you have to do the entire process again of buying those products. Okay. But testing is important to make sure that there are no issues. Okay. Monitor the supply chain. Again, very important as supply chain professionals. As supply chain professionals, we need to monitor that, okay, your products are going through the supply chain that you have created. They're not, getting diverted. They are not, products are not being, leaked from the supply chain and going somewhere else. And then some fake products are entering your supply chain. So those things also you have to monitor and manage. Implementing traceability. This is a new thing that has now come in where products must have barcodes so that you can check where are those products coming from. So if a barcode does not work, that means that those are wrong barcodes and those barcodes are not part of the system. So these are certain strategies which are now continuously being implemented in many countries and also in Nigeria. It may not be very widespread, I would say, but this is where we are. As supply chain professionals, you must know these strategies and should advocate for them whenever you get a chance. Okay. I think okay, so this was the final act, supposed to be the final activity for today. We are almost at the time limit for this session. So again, it's totally up to you. If you want us to discuss this one here in the class, we can do that. Or the other option is we send you this as a homework and you send your submissions by email to me, and then we will summarize it and send it to everyone. So it's totally your call. If you have time, I can allocate another 15 minutes, but it will be quick. Or otherwise, we can do this offline and you all submit this to me and Dr. Okafor by email. So what do you think? What is better? You can put it on chat or you can just speak out loud.
I think we should just discuss it.
Okay. Anyone else who thinks we should not discuss it right now and do it as a homework? Okay, so then let's discuss. I think there is no objection. Okay, Faisal. Sorry. Okay, so as I was saying earlier, that managing quality is a collect. Yeah, Isaac, can you mute yourself? I'm sorry.
Okay, I said no. All right, I said let's discuss it. It's better. We can discuss it. It's better.
Yeah, Dr. Samuel, you want to speak?
Yes, looking at the question, you said the first question says that we should be involved in managing
Yeah, you can take it. You can start with it. It's okay.
Yes, we should be involved in managing qualities of products in supply chain. Every actors to have a total quality system. Everyone who is involved, particularly every one that is involved in technical functions, starting from procurement. I mean, starting from yes, procurement to storage, warehousing, and to logistics. I mean, transportation to the end user. I mean, to the service point. And at the service point, every actors should be involved in managing the quality of products because we know that pharmaceutical products are not just furniture. I mean, they are not just any products. They are products that have technicalities. And therefore, if you procure right and the storage is not right, the product can be denatured, even at warehousing, if they are stored at suboptimal temperature. And the same thing in carriage, transportation to the point of service delivery point. So a service delivery point where it will also be stored temporarily, And also, don't also forget that even when you talk about management of, quality of pharmaceutical product, you also talked about what is called rational use of drugs. Because drug might be a quality product, maybe, but if it's not used appropriately, not used rationally, it might end up becomes a poison or becomes not do the job. For example, a product that's supposed to be taken 4 times daily, 6 hourly, or a product that's supposed to be taken on empty stomach. Azithromycin, for example, that's supposed to be taken on empty stomach. It's taken, perhaps the patient take it after a heavy meal, and the same patient has issue with respiratory issue. I mean, we know, or a cardiac issue, we know that can predispose that patient to a heart attack. So, total quality management should be a duty of every actor that the product will pass through, commencing from, of course, the manufacturer, where we procure, to the warehousing, to the logistics, the movement, and finally to the service point where it will be handed over to the patient. So I think let me just leave it. Let me just that'll be my contribution on that first one. Let me give you products.
Thank you, Dr. Samuel. I've written the summary of your submission in the chat. You are absolutely correct. All actors are equally responsible to maintain the quality of products. That starts from your policymakers, Pharmacy Council, NAFDAC, of course, Ministry of Health, Federal Ministry, DMAs, LMCUs, then everyone from hospitals to pharmacies to manufacturers, wholesalers, distributors, importers, transporters, and eventually the pharmacists and the physicians, who prescribe and who dispense. Everyone is equally responsible to maintain quality. That's correct. Mariam, I think you want to speak, so you are next. Mariam, can you hear me? Okay, maybe she can't. Who will take question number 2? Question number 2. So everyone who said we should discuss, now you should now start speaking.
Well, it's okay if I'm allowed to
Isaac, there is a disturbance coming from your side. Can you check?
Certainly not for me.
Yeah, Dr. Samuel, let's try to give someone else a chance. If not, then you can speak as well. Yeah. I will go back to Dr. Samuel if no one speaks. So I think it's a good time for someone else to think about question number 2 or even question number 3, whichever you feel responding to. And then eventually we will summarize. Anyone? Yeah, Aliu, please go ahead. Okay, Isaac, let me hand it over to Aliu first, and then I will get back to you.
Okay, just as they say, who is to be involved? Basically, everybody that come in contact with the product or indirectly contribute to.
Aliu, we've lost you.
usage of the manufacturing from more importantly, transport and warehousing. Because we know during manufacturing, it is essential that it has to undergo quality control to make sure a quality products comes out of the during transport and storage, because during transportation there are this maintaining the quality.
Okay, Aliu, we've lost you.
And products get handled in the shelf or in the
Okay, Aliu, you're cutting off in between. Let me hand it over to someone else. You can. I've understood part of your submission. You can write the rest of it on chat. Isaac and I think Abu Bakar Suleiman. One of you can. Yeah, Isaac. It's okay. You can speak.
Point where the products are tendering processes, where you make tender procurement, uh, you are supposed to take note of what the person is who is tendering, what product is claiming to have and to supply, uh, and then as it comes, those things are supposed to be tested to ensure that what the person who tendered claims to be is what was supplied before it goes through the distributory process. So there are some DMAs that have quality control labs. They don't just accept them in the warehouses, but they are tested and quality is assured before it gets to the service delivery point, which is the final point. And so whatever is not tested at the point of a warehousing and it goes to the service delivery point, you cannot be able to, the quality is not assured again. Thank you.
Okay. That's fine. We've noted your point, Isaac. Abu Bakar, I think you also wanted to speak. Okay. Anyone else? Dr. Samuel, we can come back. Okay. Who's unmuting?
I want to talk, yes, I want to talk on manufacturing.
Okay, Blessing, go on.
Yes, it's important that the active ingredients for a particular product is what is used, and also the excipients, because we have issues where maybe a different solvent was used, for instance, in manufacturing cough syrup. If, let's say, ethylene glycol was supposed to be used and maybe propylene glycol was used, I'm just saying it's an example. So subsequently down the line, as it gets to the end user, we have cases of children dying because the wrong solvent was used. So one supply chain function that contributes to either good quality or poor quality is the manufacturing process. We have to be sure that the right excipients and the right active ingredients are being used. Thank you.
Okay. Edineken, over to you. Dr.
Okay.
Samuel, after this, I will come to you.
Okay. The supply chain function that can contribute to good or poor quality of products studied at the last training is transportation and storage. Storage in that the product should be stored at the right temperature in a place free of rodents. The vehicle during transportation must be very clean and spacious. Also, for good to maintain good quality at the point of delivery. Thank you.
Okay. Dr. Samuel?
Yeah, thank you, Sanjay and everyone. Well, I think I mean, there is an implication. I mean, if from the question from the first question, we say everyone, that is, who perform the different functions, we contribute, are necessary to maintain quality of the product. Therefore, the second question simply means that every of those supply chain functions will contribute to either good or poor quality products. And well, I have a little divergent opinion from what the submission of the last speaker but one that spoke about manufacturing. In our system, I don't think manufacturing is a supply chain function, because we are not a manufacturing, we are not a producer, we are not a manufacturing company. I mean, sorry, country. We procure. We're largely dependent on importation. So procurement is probably the first interface of our supply chain function, which we ensure that the good product comes in. And once that is ensured, then the other functions, warehousing, logistics, and distribution, I mean, at the distribution at the service point, they contribute to maintain the quality of the good product that comes in. Otherwise, their action will contribute to make the product a poor quality product if they don't do what they are expected to do. And that will dovetail into the next question 3, that what should be the role of supply chain professional tackling this issue? Of course, as professional, the supply chain professional will be expected to enforce the quality framework that are set out to guide the quality of this product in the supply chain organization. So you must, as a professional, as a supply chain professional, you must be ready to implement, to implement and ensure implementation of the supply chain, the quality framework which has been set out. Ensure
Dr. Samuel, we've lost you. Yeah, Dr. Samuel, we can't hear you. Your point has been noted, and I will summarize it. But before that, I think Festus had raised his hand. Festus, if you want to say something, and then Blessing, I will come back to you.
Of a supply chain professional. Thank you.
It's
Festus?
okay. Yeah, good evening, everyone.
Good evening.
Yes, on the whole questions that they have talked about, I want to make my contribution basically on the last question, but it's going to be with reference to question 1 and question 2, as they have said.
Mm-hmm.
So if all we have said are accepted, because we have talked about sourcing, talked about inventory management, we'll talk about procurement and all that, which means at all these stages, all the functions available at this all that are supposed to be carried out at those stages are the things to be done better. Anyone that is not correctly done will affect bring poor quality to the system. So the last question in what should be done, that's what I want to talk about now. I want to mention few, like implementing the quality focused supply chain strategy, which means what we are supposed to be doing along the line at all times, all the things that will set on the pace or the track should be done correctly. We're also supposed to be conducting regular audits and inspection to see whether what we have put in place are being done correctly or not. Also, training and development of people who are carrying out those tasks is supposed to be looked into, because if they don't know, they will not be able to do what is expected of them. And then maybe collaboration with suppliers to ensure quality compliance from the manufacturing or the procurement or the sourcing or in the selection of the suppliers. And then using maybe data analytics or something to monitor quality performance in all through the chain. And then continuous monitoring and improvement. That's my contribution.
Excellent. Thank you, Festus. Blessing, I think you wanted to respond to something from earlier, I believe.
Yes, I wanted to respond to what he said about we not manufacturing. The fact that Nigeria is a highly we import things a lot does not mean that we do not manufacture. We have indigenous industries, pharmacies that are actively involved in manufacturing drugs. We have like EMZO, even Zolon, that is a subsidiary of EMZO. We manufacture some products in Nigeria too. So it's not like we don't manufacture at all. And that was where my contribution was coming from.
Okay. I can summarize otherwise. Abu Bakar, I think you have a submission. Abu Bakar, can you hear me? Abu Bakar? Okay. If no one has any further submissions, I can summarize it. I will maybe take 10 seconds if someone else wants to speak, because I think we have covered all the points. And I can do a quick summary then. Okay, no one else. All right. So I think we heard some very good points from Dr. Samuel, Festus, Blessing, Adinaken, Isaac, and they're all very good. First of all, to the first question, see, everyone has to be involved, and this is what a national quality framework does. Some countries have created it. I don't know whether Nigeria has it or not. You can check. But generally, Nigeria has another document which says National Drug Control Master Plan, NDCMP. I think even in that document, it provides some responsibilities of different stakeholders. But I think NAFDAC may also have a document which talks about overall quality management of products. So it starts at the top on how some policies are enacted, then how products are imported, what specifications, and Blessing, the point that you made about using the correct APIs and correct excipients. Yes, that is a point with respect to manufacturing. But Dr. Samuel, he was also right in saying that as supply chain professional, our job is to review whether they are using the right APIs or excipients or not. Because if they are using certain excipients which may eventually give rise to quality issues, then we should not be procuring those products. Or we should keep a check that the standards that a manufacturer has said that they are going to implement, they're implementing those standards. So as a supply chain professional, our job is not to tell the manufacturers to use what APIs or excipients. Our job is to check whether they are using the right ones or not. So whether they are of local manufacturers or of the foreign ones. So as NAFDAC, as DMAs, we should always check that, okay, these are the right products with the right APIs, excipients, with the right studies done, so on and so forth. So that was Dr. Samuel's point. So you are also correct. He's also correct. The perspective is different. So you are thinking from a perspective of a manufacturer because that's where products are manufactured. Yes. But the question is, how do we make sure that these products are of good quality if we are supply chain professionals? So we are not manufacturing, but we are ensuring that manufacturing is happening as per the correct standards. Okay. Then, of course, someone said about procurement. I think it was Isaac. The tender processes should be correct. There should be provision of testing of products after they're received, but also not just testing. Uh, you should first of all review all product documentation that responds to quality. Like I said, if you have procured and received bad quality products and then you go for testing, the testing will say that, okay, the product is of bad quality, but you have wasted a lot of time and resources in getting those products in. So even before you do that, you have to make sure that you purchase those products from the right manufacturers in the right standards. Only then, if you test, you will see those products are of good quality or not. But if you have not purchased them from the good manufacturers with the right kind of standards, then your testing will only say that the products are of bad quality. Okay. Um, then someone said storage and transportation. I think it was Edenekin. Yes. So storage and transportation is very important because a lot of times products come, they're imported in good quality, but then their quality is degraded over time because of poor storage, because of poor transportation. Um, then someone said implementing supply chain. I think it was Festus. I think at the end, having supply chain overall focusing on quality of products, having regular audits, training and development of people, collaboration with suppliers to make sure that they know the standards of the country and they produce like that, and then monitoring of quality as well when the products are in the market. So all of this is a responsibility of a supply chain professional, whether you are in procurement. So like your focus, if you're in procurement, you have a focus on quality. If you are working in warehouse, you have a focus on quality. If you're managing a pharmacy, you still have a focus on quality. If you are doing demand planning, you still have a focus on quality, because you have to make sure that you also when you are writing down how much products are required, you should also take into account that some products will be used for testing, sampling and testing. So those products do not go to the patients. So if, for example, if you need to buy 1,000 and 20 out of those 1,000 will be sampled and tested. So that means that leaves you 980. So if your requirement is 1,000, then you need to buy 1,020. Okay, so see, everywhere there is a focus on quality, even at demand planning. So no matter which supply chain function that you're involved in, there has to be a focus on quality all the time. And only then, by the end of it, your patients will receive good quality products. If anyone in this chain makes a mistake, everyone's work will go down in drain. So everyone has to contribute to make sure that the right quality products are available for the patients. This was the end of today's session. Again, the WhatsApp chat, the community on Hive, and all of us are available for you if you have any questions, if you have any issues. We try to resolve them as soon as possible. So please keep on finishing the course. I know a lot of you are very ahead and some of you are a bit behind. So I would recommend the ones who are behind. You still have time, you can catch up. And then the ones who are doing good, excellent job. Today, I would also like to thank Dr. Okafor. I think she's back. Yeah. Dr. Okafor, thank you so much for your time.
Thank
I
you. I've
hope
been here. I've been out.
yeah, I hope you also enjoyed the discussions. We discussed a lot of things. I know this is one of your core areas of expertise as well, and it was really
Thank
great
you.
having you here and share your views with everyone. So thank you so much.
Thank you, Sanjay. Thank you, everyone.
Yeah. And I wish everyone the best. And please do not hesitate to send us any questions or any issues that you keep on facing. Our effort is to make your learning as smooth as possible. But as you know, with technology, sometimes there are some issues. But we will try to resolve them as soon as possible. Thank you again, and we will see you next week. Until then, have a great weekend and have a great next week as well. Thank you. Thank you so much, Shreya.
Bye, everyone. Thank you.
Thank you. Bye.
Bye.
Bye.